We get to quickly look at Gaucher's disease or pseudo osteitis. Gaucher's disease, pseudo, also known as what? Pseudo osteitis. So what is Gaucher's disease? Okay. So Gaucher's disease, also known as pseudo osteitis deformans, that's the full name, is the most common lysosome storage disorder. It results from deficiency of an enzyme known as what? Glucocerebrosidase. Alright. So of course, an enzyme, if it is there, it helps in breaking down some one or two things. If the enzyme is not there, that thing will accumulate. So it leads to what? Build up of what? The Gaucher cells. That's in spleen, liver, bone marrow, bones. So what's the pathogenesis? First, there's lack of what? An enzyme known as what? Glucocerebrosidase. So there's now accumulation of the glucocerebroside. Sorry, this is the glucocerebroside is one that accumulates in what? The macrophages. Do you understand? So Gaucher cells, they become lipid-laden macrophages. They will give you a carbon tissue paper appearance because of the accumulation of that glucocerebroside. So clinical features, you have enlargement of the spleen, enlargement of the liver, low red blood cells, low platelets, thrombocytopenia. The person is weak. The person easily gets wounded. In the skeleton, you have the pseudo osteitis deformans now. All right. One thing you can see that there will be deformity is Erlenmeyer flask deformity. Bone crisis, osteopenia, Erlenmeyer flask deformity of long bones, avascular necrosis of femoral head, bone marrow infiltration leading to chronic skeletal changes, neurological involvement sometimes, eye movement abnormalities, seizures, developmental delays. So a diagnosis from trying to confirm that what the activities of this glucocerebrosidase is down. Alright, pinpoint the mutations, do bone marrow biopsies, do imagings. So treatment is what? Enzyme replacement therapy. You try to replace the glucocerebrosidase enzyme that is lacking. Also substrate reduction therapy and supportive care like splenectomies and the rest of it.